Hi,
Got it.
everybody. Welcome to Kitchen Chats. It's Andra and Karen again. And today we want to talk to you about diabetes and what you can really do. As nurses, we are outcome focused. We want to get you the best outcome we can. So when we talk about diabetes, there's two different types. There's type 1 and type 2. Type 1 is mostly genetic, but your pancreas no longer makes that insulin. Your immune actually attacks the islet cells in the pancreas, okay? And in type 2, your pancreas is making less and your body actually becomes resistant to it. So type 1 is for life, they say, and type 2 can really be controlled with diet and things like that. But because type 1 is immunity based and it's your immunity that's attacking it, you can predict better outcomes by taking care of that immunity, which is that gut health that I love so much. So let's get into it. What do you feel we've been nurses for a long time. What do you feel like the biggest problem is when we're talking to people that suffer with diabetes or are trying to control their diabetes? What do you see as the biggest contributing factor to education and things like that?
Well, type 1, I think the biggest factor is just lack of awareness because most of the time I was a school nurse for a little stint of my career. And it's the parents not being aware of what was going on with their child until their child ended up in a hospital. And then they had got the diagnosis of type 1 diabetes. And then at that point, I think the biggest challenge is just knowing how to manage that type 1 with their child. Because, children want to eat. They want to snack, they want to be a regular child, which they are. But it's just that extra toll on the parent to make sure they're monitoring what they're eating, monitoring their insulin, possibly getting them an implant that can help them to monitor their blood sugar, and just knowing what to do, when to do. So I believe knowledge is power with both type 1 and type 2. But with type 1, knowledge does come first because most of the time the parents have no idea what's going on with their child and need total education. And has to learn. But with type 2, when an older person or an adult is diagnosed with type 2, I think again, if you live your life eating a certain type of food, eating a lot of carbs, eating a lot of sugar, and then having to modify that diet, that does take some conditioning. That does take some mind change. So with both type 1 and type 2, I think it's awareness, education, and then, some discipline of knowing what you can do, what you can't do, knowing the signs and symptoms, interventions to combat what may happen, low sugar over high sugar. So as a nurse, like you said, we're looking for outcomes. So our outcomes come with consistent education and consistent help with helping our patients have that discipline to manage the condition.
Absolutely. I love what you said. And just to re-educate, the symptoms are polyuria, polydipsia, and polyphagia. You're always hungry, you're always thirsty, and you're always urinating. So if you start to see their signs, there's a clear indication that something's wrong. So what we hear today, a lot of doctors telling people that they're pre-diabetic and cut out carbs and do this and do that. And I think that when people hear that restriction, I can't have carbs, I think it puts that in their head that they automatically want it more. So my husband was told that he had pre-diabetes because he does eat a lot of carbs, and that didn't stop him from eating bagels and doing all that stuff. So I had to control the environment, and I think education is big with that too. If mom has the chips and everything laying around, the kids are more likely to have that. So with both types, it's high glycemic versus low glycemic. You can still have those high glycemic fruits, but instead of having two pieces of fruit, one high, and you might want to have one high glycemic, one low glycemic, not having two high glycemic at the same meal. So you can have fruits. You're not going to sit down and eat that bowl of fruit that some people might have. It's about doing things sparingly. And like you said, learning to do things consistently. And you can really adjust. And I believe this. I mean, the way I eat today is so much different than I've ever eaten. And if you would have told me years ago, I mean, I always like fruits and vegetables, but that I would be eating mostly fruits and vegetables, I would have said, no way, girl. I loved my steak. But the more you have good quality food, the more you want it. Your body starts to respond to it. And I
Right.
think that a lot of restrictions that people feel in their body come from the mind.
Right.
I think I think that the body is totally capable of really curing itself and really reversing disease processes, because anything that can be done can be undone. So you just have to really change your mindset about that and not fear. A lot of people live in fear. Oh, I have diabetes. I have this. I have that. But then there are those people out there that are educated and really don't care. And those are the people I'm talking to. You know better. Because
Right.
we as a nurse, I had a gentleman that was forced to have an amputation, because he wasn't doing those things we teach you, like wearing those white socks, where he would have saw the blood on the sock better and been able to get intervention quicker. But then his eating patterns were, you see, they want their fried chicken, they want with the French fries with it from the Chinese place down the block, and none of those things are really adequate meals. So I
Right.
thought it was funny. I've been out here talking about gut health for like years now, 2 years since COVID started. It's almost 3 years.
Uh-huh.
And now you see, like, the news people are getting involved, and Department of Health and all these people, and they're saying what I've been saying all the time. I'm still not in agreement with on some of that. They were talking about, the gut brain axis and how it's connected to the central nervous system. And as nurses, we know that whole body's connected. So they can try and separate it all they want, but it's one unit. And you can't change one thing and it not have an impact on another. So that's what I want to address with diabetes, that now that you're diabetic, that puts you at risk for every other disease process. The
Right.
hypertension, the kidney failure, all this stuff goes with diabetes. So if you prevent the one, you are going to have a better quality life down the road. So that's what we do as nurses. We care plan the hell out of this to look at your risks and your benefits and what we could do to really manage that. So you want to address that a little bit about the risks and the benefits?
Yeah, well, the thing with you, my cousin actually called me recently and told me that her doctor told her she was pre-diabetic because of her A1C level. Her A1C level was 6.5%. So, the doctor's like, okay, you're pre-diabetic. So she's had a little bit of a fear. And I'm like, well, you know what? You can lose weight. You need to lose weight and you have to change your diet. You have to stop eating all the carbs. Coming from a Caribbean background, we can eat rice, breakfast, lunch, and dinner. Okay. And it's not that it's like, a significant portion of that carb, of that white rice. So, it's just educating her on you got to kind of have a fistful of that rice. You got to try brown rice. You don't have to eat rice, because a lot of things for us is cultural. If you grow up eating a certain thing, you feel like you got to eat it the rest of your life. No, we can stop, or we can change, we can modify, especially if it's going to give us a longer, healthier life. So I was talking to her about that. And it's funny, I had another friend call me this weekend and say she had some kidney failure. And a few years back, she called me and told me that she was diagnosed with diabetes. And I remember talking to her saying, all right, you were diagnosed. You need to manage this to prevent it from affecting your other organs. So it really saddened me when she called me and said that, okay, now my kidneys are failing. I'm like, oh, what was going on with your diabetes, all these years? And she said it did become unmanaged. It affected my kidneys. So I just thought, of course, pray for her and talking to her about you can still reverse this. We can still manage this. You're young, you're
Absolutely.
in your 30s. We got this. We can do this. My only thing is, a lot of times doctors are quick to medication, dialysis. And I just feel like that does take us down the wrong path. Not that it's not necessary. If your doctor says it's necessary, listen to your doctor. But what I'm saying is also let's look at some other options of possibly not having to do dialysis or have to get on so many medications, always advocate for yourself. Always talk to someone else and say, what else can I do other than the extreme of dialysis? Or, is there another way? That's what I want to come put out to you
There
guys
is,
now.
and it is diet and lifestyle, because just because even though she's in kidney failure, when you have kidney disease, that's a whole new way of eating too. So now you have to manage that, and you have to manage the diabetes, and you got to see which crosses, your protein demands are different. So you got to look at a whole different aspect of that now that you got kidney disease. But I want to bring it back to that gut health, because that's where your hormones are, and your insulin resistance and all that comes into play in your gut. That's where it's controlled. So eating more of those fruits and vegetables that I was talking about earlier, those whole grains, and the healthy fats, because your body needs fat, and people don't understand that. That's your brain health. Fat has something to do with every organ in your body. It repairs. So just like the protein does. And a lot of people see fat as that, they have that fat phobia, and they picture it just storing everywhere. But if you're not using energy, it doesn't matter. They were saying on the news, calories in, calories out still matters. It really absolutely doesn't, because when you think of what a calorie is and how it's just raising temperature by 1 degree, it has nothing to do with what's actually in those bag of chips, because we don't know how they were processed, what was added. So you can't look at this bag of chips and tell me there's 130 calories in there, because you don't know that. It might have started out that way, but you don't know what they processed, what they added, how it was cooked. So it does, if you just look at things in a container, that's all you'll be able to see. If you start opening your mind and trying new things, you'll be, I want to say, in a better place. So when doctors tell you, oh, you're going to have to go on dialysis, I would always suggest that you try diet first. You're not going to see immediate results with anything. And anybody who tells you you are going to is full of shit. So, I mean, it doesn't happen like that. You don't take years of bad eating and undo it in a week. First of all, you have to recondition your mind to do things consistently. You have to replace all those bad habits with good, healthy habits. So that's all part of it. And that doesn't happen overnight. A lot of people try to do everything at once, and then they fail to do the 2 or 3 most essential things. If you do the 2 or 3 most essential things consistently, it's better than doing 12 that might not have the same results and that you fall off on. So, I'm one of those people that believes one habit at a time. That's how I did it. As a nurse, I wasn't doing as a nurse, I wasn't doing what I needed to do. Even when I was trying to change my habits, I was laughing. I was talking to my group, telling them I was the one that put that video on fast forward, thinking I was going to get quicker results. And like, your brain goes to these places when you want immediate gratification. And we have to step back from that, but I would always try diet first, because even dialysis, everything that you do, once you open that body, places you at risk. Every time you have a surgery, every time you break that skin, it puts you at higher risk for other disease processes and other infections that you don't want to have with an already compromised system. And if you have diabetes and you have kidney disease, your system is compromised. It's not acting at 100%. So you have to get your whole system back to where it needs to be. And you can do it with diet and lifestyle. So, because the doctors are so quick to say you need this medication or this is your only option, people take what they say as law. And just like your husband, when he was trying to lower his cholesterol, the doctor was very quick to say, here's Zocor or Lipitor or whatever they were going to give him, because it was easier for them to do that than to sit down and educate and say, you can try this first, but I want to see you in 3 months. And if this is not working, then we're going to move to the medication, because some people are compliant and some people aren't compliant. People that aren't compliant with treatment do wind up on those medicines. That is their only risk, because they're not doing what they need to do.
Mm-hmm.
Just so you know, there's something called right rice. You don't have to give up your rice.
And I just ordered it.
It is great. You don't have to give up that rice. You could still have the rice. Some of them are good, some of them are not so good. So if you could tell somebody that is newly diagnosed with diabetes, to what would be your word of advice to them as far as getting the information and the sources that they need? Because we know there's a lot of everybody Googles. They think Google is a doctor, and Google is just people like her and I, and anybody else can put something on Google. It's not a good source of information. And when you go to a site and they're selling something, guess what? They're more interested in that sale than they are in putting out the right information. So always be mindful of that. If you can't find a contact me page or about us page, not a credible site. So there's WebMD, there's a couple of sites. What resource sites would you suggest?
I think if you're diagnosed with diabetes, the first step, first of all, with that diagnosis from your doctor, needs to be a referral to a nutritionist. And I think certified nutritionists would be the best site wherever on Google. It needs to be Andra. It needs to be, you know, a nurse, because we're pro nurses, because we are nurses, that's going to really sit there and take that time to show you, you know, steps to take to manage it and possibly prevent you from being on any medication or affecting any of your other organs. I'm a 1-2 step type of girl like Andra. You tell me, okay, on today, Karen, lower your rice intake, lower your juice intake, try to drink more water today. Tomorrow we'll take another step. Don't overwhelm yourself. The diagnosis itself is overwhelming. When someone tells you something that, you know, is not your norm or is new to you, you're overwhelmed instantly. When I had to pull a tooth, I'm like, oh my God, I'm losing a tooth. And it was a bad tooth, you know? So I can't imagine being diagnosed with something that is going to change my whole life, change my lifestyle, you know? So take a step back, take a deep breath, and say to yourself, you got this. Say to yourself, I'm going to go speak to a nutritionist. I'm going to change my diet. I'm going to take it one day at a time. And that, you know, it's really going to make your life better. It's going to keep it from spiraling into something else, you know? And of course, positive thinking, like Andra said, a lot of this starts in our mind, guys. We can do anything as long as we commit ourselves mentally to doing it. And having encouraging people like Andra and I in your life. Always look for us. Always encourage you and give you different interventions and ways that you can manage whatever is going on in your life. So that's what I would say. First step is take a deep breath, say you got this, look for a nutritionist, look for us, look for anything that's going to keep you from, you know, spiraling into thinking that this is the end or this can't be changed.
Okay, I love that. And just preventative wise, if you have a child at home that is diabetic, type 1 or type 2, they should be carrying snacks all the time with them, because that you never know, like they go to gym and they're not prepared and their sugar plummets. Okay, so it's easier to lower someone's sugar than it is to raise someone's sugar, and a lot of people don't understand that. As nurses, once someone's bottomed out and they're below 50, it takes a long time, even with glucagon, to get it up. Glucagon takes a while to really act. It's not instantaneously, you know. Every way that you administer a medication takes a different amount of time, you know. So it still doesn't act immediately, you know. So you have to, you know, there's glucose tabs that you can purchase. There's so many things. There's glucose gels that the kids can have, but you have to prepare the child for those things. And a lot of children, like you were saying earlier, are afraid to tell people they're different, because society has made this world where it's not okay to be different or just who you are. And I don't know why that is. I'm not going to change that in this sitting, but children need to have advocates with them, friends that they are with on a day-to-day basis. They need to tell them, I have a problem. If you see this, call this person. So their friends need to be educated too. I had a student that was so, so afraid to tell her friends, you know, and then something happens. And then that was the way they learned, and how horrible it was for them to experience that, and they were hurt too, that she felt like she couldn't come to them and tell them, hey, I need help, so there's a lot of things when we look at diabetes, but eating well is the best, and you need that water because you're always urinating, so make sure you do that, make sure you're getting your sleep, make sure you're doing all of those things, but prevention is really key. So if you've been told that you're pre-diabetic and you don't pay attention to what that is, they have lowered the numbers. 7 is considered diabetic, 7 and above. If you have an A1C, 7 and above is considered diabetic. So if you're 6 or 6.5, you're right there. So you have to start managing what you eat now. So it might seem like a lot to tell you to cut back on your carbs, but you have a choice between cutting back on some of those carbs or giving yourself possibly a needle for the rest of your life, or taking a medication for the rest of your life, and then that's going to impact it. So you do want to manage your stress levels, because your stress levels absolutely impact your hormones, which is going to impact your gut health, which has a lot to do with your body's resistance and non-resistance to insulin. Insulin is part of that whole gut that I tell you about. So it's one of those hormones that are really managed. So you need to really think about what kind of future you want for your health, and just really take those steps. And if someone tells you that you can't reverse it, type 2 is absolutely reversible. You can start be eating well today and change your outcomes for tomorrow. Absolutely. A month, 2 months, you won't even be the same person. You'll be like, wow. And you'll feel better. You'll have natural energy that you never thought possible. I'm not someone who would tell anybody to restrict carbs, because they're really important in your diet, and your brain needs that sugar. But it's the type of carbs you're eating. Put away those processed foods, those sweets, all those sugary drinks that you're having. Have more complex carbs, so.
And even those alcohol beverages, sometimes we forget those margaritas, those pina coladas, they're full of sugar. And I love them. Don't get me wrong. You catch me on the beach, the pina colada margarita, you will catch me. But they are high in sugar. And like Andra said, water. Water is like, our bodies is mostly water. We need it. Walk with water, talk with water, keep water by your side. It's definitely your friend. And like Andra said, listen, it's a mental game out here for us now. There's a lot going on that causes stress, a lot. You wouldn't even believe what causes stress to you sometimes. Just getting up and not having a positive atmosphere. Automatically you're like stressed out. I have this dog, she's like losing her mind. She doesn't want to do what she's supposed to do outside. And I'm like, she's starting to stress me out. So now I got to make some changes. So manage your stress level, manage it. It affects everything, so that's what I want to leave you with. Manage your mental health, it is important. I want to say it starts there. Like Andra said, manage your gut health, be mindful of what you put in your mouth. Be mindful of what you put in. Be mindful of what you see. If you're seeing a whole bunch of negativity, it's affecting your stress level. Manage what you put in your mouth, because if you're putting in the wrong things, it's going to affect your health, your body. And after that, guys, listen, it's a good day. You're breathing, you're seeing, you're walking, you're talking. It's a good day. Anything can happen. You can make that change.
Absolutely. I love that you said that. I had to start laughing when you were talking about your dog. One of the women that I work with has a stress dog, and she just recently moved back from Florida, and the dog is stressed. I said, what do you do when your stress dog is stressed out, So it's too funny. But what I want to encourage everybody to do is, there's a lot of information out there. Some of it's good, some of it's not so good. So I encourage you to be an active participant in your health, to take back your health. People have been telling you how to live by giving you certain foods that are in your area that you can eat, and really packaging all this garbage for years. That's what we've been getting, garbage. So I want you to be an active participant in in your own health, take back control, get into the driver's seat, and make decisions that you know are going to empower you in a better future. Because at the end of the day, the control is really up to you. You give it away when you purchase things from these people that you know are not good for you, so take back that control. You don't have to shop at this market. You don't have to shop at this market, so and the food is up, 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 up. So if you're going to pay for good food,
This is true. Yep. If you're gonna work, use your money wisely. Definitely spend money on yourself, with the food you're gonna eat.
Yep.
Food, cheap ingredients, unhealthy, it's not gonna help you in the long run.
Yeah, and if you don't have a lot of money, you can get your protein and stuff from beans. There's lots of little ways around that. Buy some lentils. There's lots of ways to eat healthy on a budget. We'll talk about that next. All right, guys.
And next.
So this has been Karen and Andra. I'm sorry to interrupt you, my Karen. So this is Karen and Andra, and we want to thank you for coming and participating in Kitchen Chats. And like always, if you like what you hear here and like what you see here, like, subscribe, and ring that bell. And have a great day. Take care, guys.
Have a good one.